Hi, Mr. Iris.
Hello, doctor.
Hello. I'm here to give you a cranial nerve exam. We're going to be testing all your cranial nerves, and those are basically the information system between your brain and your face and head. Some of them are sensory, like vision and smelling. Other are movement-based, muscle things, biting, swallowing. So we will just test all of those today. All right, so the first cranial nerve is the olfactory, and it is your smelling sense. So will you please close one nostril and smell? Can you smell that?
Coffee.
All right, and on the other side?
I smell it.
All right, great. Now the next one, we're going to test 4 different cranial nerves all at once. It's your cranial nerves 2, 3, 4, and 6. So the ocular nerve is for vision. So will you please cover one eye? You can leave your glasses on. Can you read that first word?
Cranial.
All right, now cover the other eye. Can you read that word?
Tasks.
And open both eyes. What does that say?
Outcomes.
All right, great. And now I'm going to turn the light on and shine it in your eyes. Will you please follow this light? And right now I'm testing your vision, the movement of your eyes together, and I'm also looking at your pupils dilating. They're contracting, and now they're dilating. They're getting bigger. That means that they're sensitive to light. And now please watch this pencil. We're doing the trochlear nerve now. And it controls your ability to look down and in. And that looks great. Okay. So now, if you would take your glasses off, please. Thank you. We're going to test the trigeminal nerve, which is a lot of sensation all over your face, and then jaw movement. So I'm going to just brush this.
Ooh,
can you feel this?
I feel it.
All right, can you open your eyes? And just getting a little blink reflex. Very good. And then can you feel the difference of this and this?
Yes.
What do you feel?
A sharper edge was the first one, and then a more rounded edge.
Okay, great. Now the next one is cranial nerve 7, it's the facial nerve, and that has everything to do with your expressions and also a little bit of taste. So can you raise your eyebrows really high? Can you smile? Okay, great. Can you close your mouth and puff up your cheeks? All right, very good. And now I'm going to have you do a little taste test. So can you taste one of these?
Okay.
They look the same, but they taste different.
Salt.
Okay, and what about this one?
Sugar.
Okay,
Sweet.
Great. All right, the next one is the vestibulocochlear nerve, and that actually has 2 very different functions. One of them is hearing, so we'll cover up one ear. Tell me if you hear anything.
I hear it.
Okay, let's try it on the other side.
I hear it.
Okay, great. So we have hearing, but it also has functions also for your balance. So if you could get up and take a few steps, and I can watch and see how balanced your gait is. Okay. All right, now come on back. Looks good. All right, the next 2 are 9 and 10. That's the glossopharyngeal and vagus nerves. Those are very important for swallowing and breathing out of your nose. So can you open your mouth and say ah? Ah. And can you go ma? Ma. All right. So I can see that your velum is closing off when you're saying ah, and then opening so that to make so that air goes out of your nose. That means that that's working well.
Pretty good.
Can you swallow, please? All right. And I'm going to stick this in your mouth and try and get a little gag reflex, but I'm not. I will try to make it mild. Okay. It works. Good.
Yeah, it works.
And now let's hear. Can you start low and go high in pitch with your voice?
Ma.
Thank you very much. That is your vagus nerve controls that. It sounds very good. Okay, and we're going to do cranial nerve 11, which is the spinal accessory. It helps with swallowing and movement of your shoulders. So I'll hold down here and you push up against my, there we go, very nice. And now look to the left, look to the right. All right, looks good. And the last one is the cranial nerve 12, which is the hypoglossal nerve, and that controls movement of your tongue. So stick out your tongue and point it to the right, right to the left, up, down. You can move it fast, right to left. All right, very good. All right, sir, thank you so much for coming.